Good afternoon, everyone. Today, I would like to provide you with a brief update in terms of the processes in place at the Ministry of Health for when there is a potential COVID-19 exposure in a school setting. First of all, though, I would like to thank my team at the Ministry of Health who have been working diligently all weekend following a well laid out plan to combat any possible outbreak. The testing team conducted 527 tests over the weekend at Delwood, as well as 2,419 tests this weekend across all testing sites, which is an extraordinary effort. And the contact tracers have been no less busy. The way they have responded and kept us safe is well known, recognized, and deeply appreciated. I've heard many questions asked over the weekend as to why one school is asked to quarantine while another is not, even though both schools may have had some perceived COVID-19 risk. To this, I would say that it is important to remember that we have to look at each situation and each school uniquely. Circumstances and risk may be totally different, which can only be discovered through the contact tracing process. Contact tracing is rather like peeling back layers of an onion. How deep we need to go depends on what we find as we peel back each layer. The Department of Health continues to follow a thorough, comprehensive, data-driven, and scientific approach for contact tracing and making decisions around who is required to quarantine and who is not. If there is a positive case involving a school setting, the Department of Health, led by the Epidemiology and Surveillance Unit, will physically go to the school and initiate a risk assessment, such as the one which concluded today at Clearwater Middle School. As part of that risk assessment, they will meet with school representatives, including principals, to determine the positive individual's movements around the school, any interaction with others, mask wearing compliance, etc. If the individual is a student, they may ask questions about any extracurricular activities that they have taken part in, which bathrooms they may have used, and if their school bubbles have been kept separate from others. Oftentimes, the chief medical officer will also call into the meeting so that his additional questions can be answered in real time. Following that questioning, we make a decision about the exposure risk and whether certain rooms have to be closed off and cleaned. We then contact the Department of Education's facilities manager, share our findings, and they in turn will organize the cleaning. Our risk assessment at Clearwater today determined that the whole school should be thoroughly cleaned, including walls, floors, chairs, desks, bathrooms, etc. The Ministry of Health will contact anyone needing to be tested or quarantined. Like schools, people are unique too, with varying degrees of risk based on their potential exposures. So while one person may be contacted and told to test once, another person who works in the same place may be told to test 4 times and quarantine until day 14. Again, it all depends on what the contact tracers find and what the perceived level of risk is for each individual person. If you have not been contacted by the team, please do not rely on rumor, social media, or any of those other things on Instagram, etc., to determine your next steps. If you are in fact a close contact, you will be contacted by health. At this time, I would like to also urge all students, teachers, and parents to follow the recommended health protocols, and this is not a time for us to be relaxed. Parents, please remind your children to wear their mask, wash their hands often, and practice physical distancing. We really need parents to be on board for consistency to reiterate our messaging. I commend schools who are, for the most part, following public health guidance, even if it means getting creative. Some schools, for example, under Ministry of Health guidelines, have implemented breathing breaks for their students, which may involve every other row pulling their mask down under their chin for 3 minutes. Other schools permit what they are calling brain breaks, which allow children to leave the classroom to go outside without masks to get some fresh air, ensuring that they are physically distanced. Some schools are even holding some of their classes outdoors if the weather is fair and permitting. Children and teachers should wear their masks when moving from classroom to any shared space. Consider a school hallway as you would a grocery store, for example. Parents and teachers, please make sure that children do not bunch together in lines and that they do not touch one another's faces. I would like to also remind members of the public that they can book an appointment for testing at gov.bm, the coronavirus Get Tested. I wish to close by saying that I have full confidence in our epidemiology and surveillance unit and our testing teams to evaluate the extent of any outbreak and to ensure, first and foremost, that it is contained. Thank you.
Thank you, Minister Wilson. Good evening, Bermuda. Before I begin my press statement, I would like to reiterate that the safety and health of all students and staff is the priority of the Ministry and the Department of Education. I know that many of us are feeling anxious with the recent increase in the number of COVID-19 cases on island, especially as there has been close contacts to local schools. As we continue to navigate the effects of COVID-19, we do so in concert with the Ministry and Department of Health. Our commitment to our school family is to keep safety and health a priority, to be transparent, to keep our school staff, families, and the public abreast of any new developments. These are unsettling times, and we understand the concerns shared by parents, students, teachers, and staff. As a parent with a child at Whitney Institute, rest assured that I too understand how the latest COVID-19 testing results are troubling for our schools and our families. But we must continue to trust in the expert advice from the Department of Health to continue to guide us through this pandemic. When test results are received, we work in sync with the Ministry and Department of Health to communicate information to school staff and parents, and will consistently follow their instructions for the actions to be taken. Further, it is the Ministry of Health who assesses the risk of any COVID-19 developments in schools, and they determine the best course of action to keep our students, our staff, and the community safe. Now that I've provided some background information, I will provide you with updates regarding the COVID-19 developments at Clearwater Middle School, Diallo Middle School, Paget Primary, West End Primary, and St. George's Prep. Clearwater Middle School. In the case of Clearwater Middle School, the initial report that one person, a non-teaching person, had tested positive, but the school could open today, and an assessment would take place. Last night I released a press statement and a video explaining this information. The school did open this morning, and there were 23 students and 15 staff present. After students and staff had been on the site for 2 hours, the Department of Health gave instructions for staff and students to exit the premises so that deep cleaning could take place. The Department of Health has reported that this is the current status of the school. I wish to offer my heartfelt thanks to those who heeded the advice of the Department of Health and reported to work today. As shared previously, in the event of potential COVID-19 exposure, classrooms and any affected areas are deep cleaned and inspected before students and staff are allowed back into the building. The Department of Education's facilities team will coordinate the deep cleaning of Clearwater facilities. A meeting took place at the school today to discuss the deep cleaning plan, and deep cleaning will take place on Tuesday and Wednesday. This will mean staff and students will not be able to enter the building on these 2 days. The principal will communicate to parents at a meeting planned tonight at 8:30 p.m. the process for distributing learning packets to students for these 2 days. The Department of Health will determine whether any additional action is to be taken, and then we will advise our parents, teachers, and staff of the date Clearwater Middle School will reopen. Delwood Middle School. Delwood Middle School students, parents, and staff have been asked to quarantine. Teachers and students will transition to a remote learning schedule on Wednesday, December the 2nd. Students who do not have mobile devices will receive non-digital learning packets, and the process for collecting the packets will be communicated to parents by the school principal. St. George's Prep. Staff and P2 students who are under quarantine returned to school today with high attendance rate for staff and students. teachers and students jumped right back into the class, and the day started with a class meeting held to review class and school rules and protocols. West End Primary. Students and teachers at West End Primary's P5 also returned to school today. Staff and student attendance rates were high, and teaching and learning took place as normal. A wellness check was carried out for the class, and a guidance counselor remained on standby in the event any students were anxious or worried. Overall, the teachers and students reported doing fine. Paget Primary ASD class. The Department of Health also gave clearance for students in the ASD program at Paget Primary and staff to return to work today. Overall attendance was high for students and staff, and the staff was reported to have mixed emotions about their return. Travel within the public school system. As we approach the holiday season, there is a possibility of more people traveling. As a reminder, if you or anyone in your household travels, including family members or guests returning from overseas, your child will need to observe the current quarantine requirements. A student can return to school once a negative day 8 result tests are received by the office. In addition, if anyone in your household is required to quarantine due to close contact with COVID-19, your child should also quarantine if directed by the Department of Health. Children who are quarantining at home will receive either electronic or hard copy work packets. The Ministry of Education appreciates the cooperation of the Department of Health and teachers throughout our public school system. Let me extend my appreciation to the Ministry of Health team who set up the testing at Delwood Middle School this previous weekend. In closing, I would like to urge our students, teachers, parents, and the general public to understand that the procedures outlined are to be followed to keep our schools safe and healthy. The critical message I want to end with is that we need to wear our masks, practice social distancing, wash our hands, and keep our bubbles small. We all play a critical role in keeping our island safe. Let's do our part, Bermuda. Thank you.
All right, members of the media, any questions? Owen?
Good afternoon. Owen Johnson Barnes with the Royal Gazette. Minister Wilson, you have recently released the new statistics regarding COVID. The rates seem to be going up. 9 new cases confirmed over the weekend, if I recall correctly. A lot of people in the public are concerned that there's going to be another lockdown. Can you say if that's something that government is considering, or if government is considering further measures to limit the spread of the virus?
Well, with respect to that, if we did return to a shelter in place, is the term that we actually used, there's a number of considerations that we have to look at, and that would certainly be a last resort. Back in March and April, when we instituted the shelter in place for the month of April, we didn't know as much as we know now. Obviously, science has advanced tremendously. We have improved testing facilities, as well as the ability, more enhanced contact tracing. So we are not in the position that we were in April when we had the shelter in place. Furthermore, you'll note that I indicated last week that there will be changes to the regulations, to the COVID regulations with respect to the size of large gatherings and the like. And the Cabinet Subcommittee, COVID Subcommittee, meets regularly, and Cabinet will be meeting tomorrow as well, as you would know, to discuss any type of potential rollback measures. So all of those are part of our discussions on a regular basis. We look at the facts, we look at what the scenario is with respect to the transmission rates, but insofar as ever reverting to a shelter in place like we did in April, that is extremely unlikely. However, having said that, if we notice that there are trends where people are ignoring the guidance, not wearing the mask, not participating in physical distancing and the like, then that is certainly something that will not be removed from the table.
Now, obviously, there are several workplaces that have had quarantines of their staff. Some schools have had quarantines. Can you confirm how many people are actually in quarantine right now and not able to go to work or school, at least physically?
I do not have that number in front of me. Obviously, as you've indicated, you would have heard the Minister of Education speak about a number of schools. You've indicated that there are certain places of employment that have disclosed their own. I'm not going to disclose where they are, but they've disclosed publicly themselves. I don't know. I don't have that number off the top of my head. I perhaps might be able to try to get it for tomorrow evening's press conference in terms of the total number of quarantined persons. I do not know.
Is that something that might be able to be released as part of the regular updates that are provided by government?
Because that number fluctuates so often, we're more concerned about concentrating our efforts on the cases and so forth, as well as providing the public health guidance to those persons that are in quarantine. I'm just not sure that's a good use of our resources to count how many people are in quarantine, because that number changes regularly.
Mr. Rabain, you mentioned in your main comments that the students and staff had mixed emotions at Padgett Primary about returning to school. Can you tell me what concerns they had and what the government is doing to address those worries?
Well, we do, as I did mention in the statement, we have counselors on board to address any concerns that anyone may have, and that is in conjunction with EAP as well, which we are a member of. And so the mixed emotions would be some anxiousness of returning to schools. I know we had a couple of teachers saying, wait a minute, we were asked to quarantine, aren't we supposed to be out for 14 days, but we're coming back sooner than 14 days. And those things are simply explained, as we talked about in both of our statements, that guidance comes from the Department of Health. Once they do their assessments of the school, they're able to then make those decisions. And it's just a matter of explaining that and making sure people grasp that concept.
Now, in the case of Clearwater, the statement yesterday was that students and teachers can go into class. Yes. And then, of course, you announced today that it's going to be shut for a few days for deep cleaning. Mm-hmm. Was there a change of plan in there? Was it a situation where you had expected classes would resume as normal and then that had to be backtracked? Or is this a situation where you brought them in for a different purpose?
No, as I just said, and I reiterate, we take our direction from the Department of Health. And the Department of Health assessed the situation of the person that did test positive and said that the school was safe to open. And then they went and did their assessment as they did with Delwood. Once the assessment was done, a recommendation was made that the entire building be deep cleaned, and that is the result of why we asked the students to leave and why we will be doing the deep cleaning on Tuesday and Thursday, and the school has to remain closed on those 2 days. Notice we did not say that we had been issued any instruction from the Department of Health to say that anyone had to be quarantined.
And can you tell me what class attendance has been like? Do students feel comfortable enough? Do parents feel comfortable enough to send their students to school? I mean, you mentioned that only around 20-odd students attended Clearwater.
Yes, at Clearwater, it's unfortunate that there was some staff that did not report to work, and it's unfortunate that the parents did not send their children. They have their particular reasons for doing such, but it was safe for them to return this morning.
Thank you very much.
Good evening. Don Burgess, Bermuda Broadcasting. Health Minister, 9 new cases were today, 2 of which had no known links to clusters or travel. We now have 37 active cases. At what point do we use the label community transmission?
I'm going to, if you don't mind, repeat the answer that I had when that question was previously asked. It's a very important question, which is why it obviously comes up quite often. There is no magic number for community transmission. Community transmission is it's a definition by the World Health Organization, and it's based on a number of circumstances. What might be constituting community transmission in one jurisdiction versus a small jurisdiction such as Bermuda are totally different. There's a number of factors that goes into that, and it's effectively when you have a number of individuals that the persons that are under investigation far surpasses what would normally be epidemiologically acceptable, because you cannot tell where the transmission lies. So therefore, in those circumstances, we would say that we have community transmission. Bermuda has not been classified as community transmission. We're not classified community transmission right now. It's sporadic cases.
Okay.
And I think you said 2 persons.
Not linked to travel or clusters.
They're under investigation. Okay. So under investigation means we haven't been able to ascertain where that index case received the transmission from. So under investigation is different, and that's what they are.
All right, thank you.
Mm-hmm.
Both last week and this week, there's been made a lot of mention about schools and keeping the kids in bubbles. But what sort of problem do you see when the kids have a school bubble, then they have an activity bubble like dance or sports, then they have a church bubble, then they have a neighborhood bubble, and then they have a family bubble. So it's putting the blame sort of like on schools.
No, nobody's putting the blame on anyone. Our public health messaging has always been consistent, and we're trying to encourage people to keep their bubbles small. If you decide to venture out of your bubble, so to speak, then we're encouraging you to use the public health guidance, such as wearing your mask, proper hand hygiene, keeping your hands out of your face, as well as physically distancing.
Sorry, but do you see any problem with them having so many different bubbles that they're involved with?
Again, the public health guidance is to reduce the size of bubbles. So I would certainly hope that there aren't children that are in the 9 different categories that you just spoke about, and that parents are adhering to our public health guidelines to keep your bubbles small and tight, particularly in the midst of a pandemic.
Thank you. Bermuda Broadcasting has heard from confused grandparents this afternoon who have just been told that they must quarantine after they called the COVID hotline. They've been told that because their teenage grandchild who lives with them came in contact with several children who attend Dellwood, that everyone in their household must now quarantine. Who decides who should quarantine, the COVID hotline or contact tracers within the Ministry of Health?
Thank you, Don, for asking that question. The persons, and I need to emphasize this because that's a really important question, and oftentimes people will call the COVID hotline, who are there as a resource to provide as much information they get. People will call the COVID hotline to say, what's the fire department's number? They get a myriad of questions, many not related to COVID. However, if a person is asked to quarantine, they will be contacted directly by the contact tracers at the Department of Health to give them instructions. So they must adhere to the contact tracers that will give the call. It will not be, if you call the COVID hotline and say, should I quarantine because my grandchild's son, twice removed, goes to Dellwood, those persons are not equipped to provide that information. Wait until you're contacted by the Department of Health.
Thank you. Some grandparents
Thank
will be
you for
happy.
that question. That's important.
Many Bermudians are rightfully worried about a potential second wave associated with local transmission and the rising active case numbers. The public wants timely information. DCI released multiple press releases yesterday, but the government did not release any COVID testing and case numbers yesterday. How come?
I indicated, I think probably about 5 or 6 weeks ago, that we were going to give our team a break on a Sunday. Unlike most people, we've been working heavily since the 3rd week of January on this, and it was necessary for them to receive some type of break. So we decided not to release test results on a Saturday and Sunday. That was announced probably 6 or 7 weeks ago, so we stopped doing it. However, we released results Saturday simply because of the circumstances that we're in. But it's not something that's going to be regularly repeated. We're just, at this point, because of the increase of cases, we will. But when we will revert to the Monday to Friday once we have this position stabilized. But that was 7 weeks ago. We haven't released the Sunday result.
Okay. All right. Thank you. There were very long lines at Shelley Bay Marketplace on Saturday for tests. I mean, pictures were circulated on social media. Will the sudden rise in active cases prompt government to increasing pop-up testing options and put a regular pop-up location back into Hamilton? I know we've asked that several times, rather than trying to trek to St. David's most days for testing.
We will be releasing our new schedule probably within the next day or two. We have secured alternative locations. I appreciate you consistently asking that question. One in the east, one in the west, as well as centrally located. So you'll be pleased to know that information will be revealed probably within the next couple of days when we release the new schedule. So there will be more testing available, more pop-ups available on a regular basis at different locations that are all not subject to the weather. And that information will be revealed in the next couple of days.
Thank you. It seems like the public's more concerned and they're doing the right thing.
Absolutely, and we're encouraging people to get their tests. That's right.
We have 8 cases under investigation, unrelated cases, no links to travel or recent clusters that you've been able to find out to this point. This is the largest number of under investigation cases we've had at one time in Bermuda. Is this type of case the one that would most likely shift us from the WHO classification of cluster of cases in the community transmission? And how close or far away are we?
I answered that question a few moments ago.
Okay.
We are in cluster of cases. The WHO classification for 9 cases that are under investigation, and they are still under investigation until 14 days. So we're still within the time frame with respect to the investigation portion. However, we're not anywhere near the classification for who and the circumstances that would warrant community transmission. We've never been close, and we're not close now.
Okay. Thank you very much.
If you
Okay.
ask me a technical question tomorrow, Don, I'm going to be very angry because I got the CMO right here. He's just sitting
That
there.
concludes the press conference. Thank you very much. There will be another Minister of Health will be back tomorrow with another press conference. Thank you.